It's Dr. Kave here on this live now to talk about how surgery, like in your deepest, darkest moments during it, you have the mask on, you might be paralyzed, you might be kind of stripped naked for your surgery, how in that terrifying time, not only can depression get worse, but maybe depression can get better. But most patients don't talk about this. We focus so much on healing the body in surgery, which is good. We sometimes forget to talk about healing the mind, right? Healing the body and the mind. So just as people are trickling in here, I love it. I love it. Remember, on the Discord, we can keep up with all of our questions as we talk about this fascinating topic, because the last statistic I heard was that over 1 in 10 adults in the United States take some form of antidepressant in the last 30 days, and this was before COVID, right? So those patients are coming in for surgery now, and even if it wasn't a pandemic, I don't care. Depression can lower your pain threshold, can increase the risk of numerous surgical complications. Because the mind-body connection is so strong, having depression not only is sometimes apparent when you're under anesthesia because your body opens up like a book, but can also make your surgery more complicated, can make it harder for you to recover, might increase your risk of infections or nausea when you wake up from anesthesia. And yet, at the same time, surgery might be a valuable, precious period for you to actually heal your depression. Sounds nuts, right? Because no one's probably ever talked about this. I didn't learn about this in medical school or in residency. But being an integrative medicine specialist, it's something that I've done a lot of research in and worked with a lot of patients through. Because depression is no joke, and especially when you're under anesthesia, it's all the more important to have the right mindset. Now, I'm not saying that we should delay important surgeries to treat depression. That's not true for all surgeries, for some possibly. In particular, things like bariatric surgery, maybe coronary artery disease like CABG or bypass grafting, if time permitting, and lumbar discectomies or lumbar, like lower back surgery. These are some surgeries where, time permitting, you really want to have your depression and mental health in the most optimized state, because those particular surgeries have well-documented adverse outcomes in depressed patients. How heartbreaking is it to go in for heart surgery and 12 months later be at a higher risk of having another cardiac event, like another heart attack or stroke or something, because of something that you may have been able to have under better control, like your depression, prior to undergoing that major open heart surgery. Now, once again, I'm not saying to not have your open heart surgery. Very, very important, depending on the kind of cardiac disease you have. But if we can optimize our mental health before surgery, the gains are very tangible and can be taken with you even outside the operating room when you're done with surgery. So let's keep up with the comments here as people are trickling in. Hello, Pika Kirby, Ashley, Heidi, of course, thank you so much for your support, everyone. Right. I've had surgeries and wanted to keep the mask they put you to sleep with, and even asked to keep it, but they didn't give it to me. Why can't I keep the mask they put? That's a good question. Actually, I would give it to you if you asked me. I think it can be a powerful object for some patients to have a ritual with. And what do I mean by ritual? You guys are going to think I'm crazy, right? Some patients, not all, but some patients can have a healing experience through a ritual kind of practice, like maybe breath work, maybe getting up in the morning and brushing your teeth is something that you are giving yourself a positive affirmation for to start your day in a way that catalyzes a healing experience from something as mundane as brushing your teeth or going on a run or saying hi to your spouse or your dog or whatever. Maybe the object in your case, just because surgery is such a profound experience for many, sometimes and unfortunately associated with trauma that can lead to PTSD, worse depression, worse anxiety, etc. Maybe having that mask would have been a powerful object for you, to actually have a ritual that could help you recognize what the surgery did for you, to help you heal your body, so that you can now move forward to heal your mind. Everyone's different. Your choice of a ritual, if it's something that you would want to do, depends very much on your past experiences. It's not a one-size-fits-all. But when you find what resonates with you, you open a door to an incredible potential that you may have never had before. A common one we see in the operating room, I wish it were more common, is people that can quit addictive habits. The most harmful one is what? Smoking. Waking up, quitting smoking cold turkey. There's a patient that one of my mentors once told me about who was able to quit their benzodiazepine addiction. Benzodiazepines, we use them in the operating room a lot, right? They unfortunately have many, many dangerous side effects, and especially addictive ones. This patient was able to actually thank her Ativan for what it did for her for the period of time that she used it, and was able to put it aside through a powerful ritual that I can't pretend to know how powerful it was for them, or what experience led them to that practice. But it worked. And I got to say, we don't have any good medications, IV or oral or whatever, that can be that effective for addictions. We don't have miracle drugs for quitting smoking, which is probably the most impactful thing you can do for your health. We don't have miracle drugs for opioid use disorder. We have good ones. Suboxone, great. Methadone, great. We have a couple, but they do have side effects, and they're far from perfect candidates. They can be augmented with the right mindset. So anyways, I hope that, who went on a tangent, but what you said about the mask, I'm so happy you brought that up. Thank you for being vulnerable and sharing that story. Pika Kirby got depressed after her injury last year. So in the last live, we were talking about how depression can come from many things before surgery and after surgery. Pain is one of them. Pain and depression have a bidirectional relationship, where being depressed can lower your pain threshold. So being depressed can make your pain worse, and having pain can cause you to be depressed, which is why for some patients, simply having the knee replacement or having the hip replacement or having whatever surgery to alleviate the pain that they have pre-surgery is enough to get their depression back under control. There's many other things in the operating room that can be healing for depression. That's just one of them. But it's a powerful one. And your chance of having less pain after surgery depends on the preparation that goes into it, including controlling anxiety, PTSD, having the right nutrition, physical activity, etc. Things we talk about in other videos as well. So, I love it. Jay, good to see you on here. I agree that Jay's asking if their anxiety is under better control, are they less likely to wake up with emergence delirium? Well, probably. There's a difference between giving somebody chemical handcuffs like these guys here, these medications that I showed you. I can chemically chill you out with something like this. I can chemically restrain you with something like this. I can literally turn your brain into, like make it a little bit, I don't want to say mushy, but I can put it in a place where it won't respond very well with something like this, if it comes in focus, right? I can give these, but these probably are not something that you can take with you after your surgery, after the operating room, to have a healing experience after. Which is why, in those moments before we go to sleep, like I said before, is a precious moment. All of life is precious, right? But it's a precious short moment, a window as the medication is going in for you to lose consciousness. As the mask is on your face there, and those precious last moments before you lose consciousness, to get a sparkle in your eyes, if you know that you're loved for, cared for, guided, if you have trust in who's with you there. And like in the last live I was saying, when I tell my patients before they fall asleep, I don't waste time counting backwards from 100, subtracting 7s or 15s or whatever. No, I tell them that they are loved, that I'm going to be with them there, that they're the most important person to me for the next 2 hours, the most important person in the world to me. And I'm with them. And the whole team in the operating room is focusing on them getting better. Those are the affirmations that I give to patients, among other things, right? Things to help reduce nausea, hopefully blood loss, help them wake up with less pain, etc. Those are, plenty of other things to say as well. But the core is to feel loved, cared for, guided, not alone, which I got to say is easy in those desperate moments when you're under anesthesia, just on the table, like the one behind me here. I'll show it to you, right? This table behind me here, right? When you're on here, yeah, it's easy to feel alone. It's easy to feel vulnerable. It's easy to feel like you got nothing to hold on to. But that's never true, especially not if you're my patient, because I'm with you the whole time, right? Moving on to other great questions here. Are patients that take medicines for mental health, like SSRIs, at risk for more side effects? Timothy, great question. SSRIs are very powerful, very, very helpful for some patients, typically for finite periods of time. They have side effects like disrupting REM sleep. Unfortunately, poor sleep can exacerbate depression, and depression can cause poor sleep. So it's, once again, bidirectional, just like depression and pain. The ideal way of using medications like SSRIs are to use them for short periods of time while the rest of the body is healing. In the best case scenario, one would try all the natural ways of addressing depression before taking medications. However, that may not be possible for all patients. And it's absolutely, and please listen, it is absolutely not a blame on patients. It's not a letdown. You're not failing anyone. You should not be disappointed if you do take those medications. Taking those medications and working on healing yourself is a better mindset than taking those medications, but I feel bad about taking them. I hope that resonates with people. Maybe you've experienced this before, or you know someone who's experienced this. Let me know. Hey, if you check out the other videos, if you leave comments there, I will respond to them. So you can ask your questions on my videos. I love to see the sparkle in your guys' eyes when you have those epiphany moments. Being anxious can make your pain worse and cause your body to react and release stress hormones. Vicious cycle. Jillian, you are correct. Kathy, proper pain management after was missing from my ileostomy surgery. It took a long time to heal. Kathy, I'm so sorry that you experienced that. Remember that your mindset has an impact on your wound healing to an extent. The longer it takes your wounds to heal, the longer you're going to be in pain because your wounds aren't fully healed. So anything that can improve your wound healing, and that includes nutrition, like getting your blood glucose under control, not being anemic, having the right protein intake, right vitamin D, etc., those things can all help your wounds heal more efficiently and help you get over your pain faster. Your mindset also impacts that. Possibly just because of the increase in systemic vascular resistance, or your blood vessels, fancy way of saying your blood vessels narrow down when you get nervous. I personally get cold fingers when I get nervous, when I get anxious. Maybe you've experienced that too. If I connect myself to the pulse oximeter, you literally see my pulse get weaker and weaker in my fingers when I get anxious, right? It's maybe a little bit different than Raynaud's, but there's likely some impact there. In fact, you see me put the temperature strips on my fingers, right? If you put a temperature strip and you measure the temperature of your fingers, you might see the temperature go up as you go into a more relaxed state. It's because you're increasing blood flow to your fingers. So after surgery, if you can increase blood flow to your wounds, you will help them heal faster. At least that's our belief in perioperative medicine. What about Precedex being used for, okay, Precedex, Nolan. I hope you're still here, Nolan. Precedex, interesting drug. I use it from time to time. Not terribly good evidence for this, but it's still a powerful anesthetic nonetheless. James Patterson, hey, good to see you. All right, guys, so many questions. I'm trying to keep up. Any tips on coming off benzos? Emily Washington, wow. Maybe we'll end with this topic. I know Heidi wants to talk about Raynaud's. We can talk about that too, but let's talk about benzos and addiction. Benzodiazepines are very powerful medications. To be clear, they can be life-saving in certain circumstances. If I have a patient who cannot tolerate anesthesia, let's say maybe a patient who's had a trauma, has had an immense blood loss, it's not focusing. What's wrong with this? Focus. Anyways, right? If I have a patient who cannot tolerate general anesthesia, either a gas through the mask or IV agents like propofol, midazolam might be the only way to safely have them go through what might otherwise be a painful procedure. So there's a lot of power in benzodiazepines. There's weaker ones, obviously. Maybe Klonopin you've heard of, clonazepam to help with sleep. But the point is that they have addictive properties, very, very clearly. Also, they have rebound effects and tachyphylaxis. You take the same dose of a benzodiazepine, over time, that same dose probably is not going to work for you as effectively. So you need higher and higher doses. And there might be a rebound effect where if you stop taking your Ativan, you might feel a rush of more anxiety. Because your body pushes back, right? It's a homeostasis that your body has. Your body wants to do something, right? And you give it a medication to block it, well, your body's going to try to overcome that medication. So when you stop taking that medication, now your body's floodgates have been released and boom, the full effect comes forward. Beta blockers have similar effects. ACE inhibitors have all sorts of things. Not only benzodiazepines and PPIs, but all sorts of medications can do this. So very important to consider the addictive potential of benzodiazepines. And this goes into the whole talk about addiction. What is addiction, right? Short-term benefit at the expense of long-term harm without an abort button you can press to break that cycle. Short-term benefit at the expense of long-term harm. And you can't hit the abort button. That's addiction, right? Unfortunately, and this is a whole topic, maybe we'll talk about it on the next live. Addiction, depression, anxiety, these unfortunately are diagnoses in our Western view of the world, which is powerful for many things. But sometimes we forget that they might be symptoms of an underlying issue. It's like you coming to me and saying, hey, I have a bad cast. You got to fix this cast. Like, I'm not going to be better until my cast is better. And it's like, well, hold on. Why do you have a cast in the first place, right? Your problems, yeah, the cast we need to fix, but you have a broken bone underneath there, right? There's an underlying cause. Addiction is trying to fix an unmet need in many patients, right? An unmet need. What is the unmet need is the question. You can look at like sex or gambling or whatever, all sorts of things are unmet needs that the addiction is trying to help that person cope with. And if we're not talking about what the unmet need is, it's like you saying that the cast is the source of my problems. It's like, no, it's not the cast. It's the broken bone underneath the cast. Guys, I love your questions. I love your questions. I unfortunately do need to get going. My phone is about to run out of battery and I have to get home. But I hope you guys just remember that you have more power over your health than you've probably ever been told. Hit that like button, share with others what you've learned today. Remember that there's so much that even your darkest moments in the operating room, you can use to help you heal yourself in ways that you probably didn't know possible. So do check out the other videos. Check out my website, medicalsecretsmd.com. The links are all in the bio. Check those out. Remember that you have more power over your health, right? There's so much that even in the most stressful times of your life, you can actually spin to your advantage. And I hope that you learned something. So remember to keep up with all the lives by subscribing and share what you learned with the people that you love. Until next time, take care.